Hello, everybody. Good afternoon. Really happy to have you here today for our reuse community practice webinar. And today's webinar is Story Time, the Pandemic Impact on Assistive Technology Device Reuse Programs. And I'm Marty Exline with AT3. And at the time we were putting this together, or thinking about it, I think we were all hoping that maybe the pandemic would kind of be in our rearview mirror and that we would be looking at COVID as something that happened and moving on. But of course, that isn't exactly what's happening with the Delta variant. And certainly there's surges in a lot of areas. My state, Missouri, is certainly one of those. And I know some of yours are too. So it's an area that we absolutely are still dealing with and will be dealing with. I did want to make note of the 4 state level projects that state AT programs provide: device reuse, demonstration, device loan, and state financing. Definitely in terms of demand, reuse was the one that, in terms of the demand, stayed high for reuse programs. About 75% of states reported that either their demand was unchanged or that actually went up. And just a smaller number than the other 4 state level services actually experienced a decrease in demand. So certainly that's important to all the people that you serve. And the states have done an incredible job in just making adjustments to their programs, making them safe, not only for consumers, but for their staff, and somehow figuring out a way to make it work. And that's some of what we're going to talk about today. I'm going to go ahead and in a second let Carolyn and Liz introduce themselves, but let's move on to the second slide. So just a few reminders. Certainly, if you need the captioning, click on the CC button on the control panel. If you do have any questions or comments, put them in the chat window and we'll track those. I'll try to keep a watch on those, Carolyn and Liz. And then certainly be aware that for upcoming events, check out the AT3 Center Net events page. And we will have a post-webinar survey that you'll receive, and please complete that. And one of the most important things is the question about what other topics that you'd be interested in related to reuse in dealing with. So please don't forget to do that. So go ahead and move on to the next slide. So with that, I'm going to go ahead and turn it over to you, Carolyn.
Thank you so much, Marty. Really appreciate this opportunity. And I know Liz and I say it all the time, we absolutely appreciate this collaboration with AT3, with Marty and Dave and the whole team at AT3, and then of course all of you around throughout the states and territories. We absolutely appreciate the opportunity to work with, learn from, and continue to grow with all of you. So yes, this is a collaboration with Tools for Life and the Center for Inclusive Design and Innovation here at Georgia Tech. And I am Carolyn Phillips, and honored to be working in this space of reuse. It was one of the early loves, assistive technology reuse, primarily because I was one of millions of folks with disabilities that couldn't afford assistive technology. And so started a computer reuse program way back in the 90s, and have been, working in this space of assistive technology, accessibility, inclusion, policy, research, all of those things, but still have a deep love for the work we've done with the Pass It On Center and with all of you, because access is really, awesome and important, but acquisition is where it's at. So for a lot of us. And so I have the great pleasure of working with Liz Prasad. We actually are celebrating 20 years together, which is awesome. And I'm so glad, Liz, that you said yes to come in and doing an internship with us 20 years ago. So I'm going to turn it to you.
Thank you, Carolyn. Hey, everyone. I hope you're all doing well today. I'm Liz Prasad, and I serve as the Program and Outreach Manager specifically with Tools for Life at the Center for Inclusive Design and Innovation at Georgia Tech. And yes, as Carolyn said, I started many moons ago, 20 years ago, as an intern, and it has evolved. And I'm very proud to say that I'm now the manager of Tools for Life, and working alongside such an awesome team, not only on the statewide level, but definitely national. And of course, all of the work that we did in the space of reuse and with the Pass It On Center is so very near and dear to my heart. So a lot of great memories with a lot of great events, with a lot of you on the line throughout the years on a national level as well too. So definitely looking forward to spending this time with you to talk about just what's been going on in our world with AT reuse the past year or so. Thanks for having me. I wanted to let everyone know that, as Marty said, we're going to have a survey link at the end. Please take time to fill it out. We'll plop it in the chat and have it up on the screen as well too. And so again, we just always want to hear from you, anything that we can do to help you out, any topics that you want to hear in the future. Please utilize this platform to give us that feedback and let us know what you think. Awesome. So the next two slides, we've got today's session and learning objectives. Definitely, as we're recovering from COVID, I don't know if I really want to say recovering, but as the world is just kind of moving on, right? Everybody's ready to get back to stuff, but there's still so much going on. Definitely at this point in time, it's so appropriate to sit back and examine just the impact that all of us have had in the AT reuse world, as you know, within the states and territories as well. And so this webinar specifically is going to explore the impact of the pandemic and related public health guidance and restrictions that force AT programs to modify reuse operations, of which customer segments were mostly affected, and how all of the operations were modified to respond to all of those changing circumstances. And so we'll just take a look at the role of some of the activities in everything that's been going on, and especially how we can utilize all of this to impact and further shape our future emergency planning.
I really like this image that you found, Liz and Trish, also Trish Redmond, who helped us pull this together and such a vital part of our team, because I think it says a lot of what a lot of us have experienced about the impact in our operations, whether it's the financial and customer supply chain. Definitely when we're talking about reuse, that's absolutely a big part of it. People, and absolutely the technology piece.
Yes, absolutely. Yeah. All right, our learning objectives. So at the end of the session, you all will be able to list 3 changes in AT reuse operations caused by the pandemic or resulting circumstances. The second objective, you'll be able to identify 3 ways that customers were affected by changes in some of the reuse operations. And then lastly, be able to identify 2 reuse program changes that might be useful in responding to future emergencies. So again, we hope that throughout our talk today and just everything that we've learned from all of you, that we can collectively take that to shape some of our future planning for other emergencies as well. All right. So thank you to the reuse program. So thanks to Marty and Kim and Dave and Trish Redmond, Carolyn, we put out a survey, just some basic questions, just to find out a little bit more about some of the challenges, the good, the bad, the ugly, that all of you have been facing as well. And so thanks to the programs who shared their experiences, who responded to the survey, who described their experiences and case studies as well too. I know Trish kind of spent some time on the phone and email as well too, just reaching out to some folks to get more information. So we really appreciate everyone's enthusiasm to contribute to this information. And so again, we're sharing all of these experiences for the benefit of everyone here on the line today, and especially for those that we're serving as well. There's a little graph over on the right-hand side, like a little flow chart up at the top. It says policies. Underneath, there's some boxes that say product, premises, processes, people, just a tongue twister. Underneath, customer experience, and then at the very bottom, performance measurement. And so this diagram is from the International Customer Service Institute, illustrates that policies, product, premises, processes and people contribute to that customer experience, and that performance measurement informs changes to policies for a continuous improvement process. And absolutely, we see that every day, but we're seeing that continue during the pandemic. So just a fun little chart that just shows how it all relates and how we definitely can utilize this for improving all of our processes going forward.
It's, Liz, you said it, and so has Marty. I think a lot of us thought, because we've been through emergencies together, a lot of us collectively together have been through this, thought that we would be, in a space where we would be telling the story and we would be in a different phase. And so, what we would call that an emergency, and the work that we've done within emergencies would be that mitigation phase, like where we're looking back, what are the lessons learned, reflecting all of that. I'm very glad that we are doing this webinar and this topic in particular now, because there have been a lot of important lessons learned. Y'all did a great job sharing so much with us. And so we are going to be looking at various sections and various topics and diving in with all of you. And so this first section here is how the pandemic and health guidance impacted reuse operations. As y'all recall, and we're so glad that so many of you do actively reach out to us, the initial concerns about the virus was all about transmission. There were a lot of unknowns. And I think that once again, being within the ATAC communities and specifically within the reuse community, this is a community that responds quickly and thinks about innovative solutions. And so there was a lot of questions that y'all had, also that you were sharing when it came to healthcare guidance. So a lot of the healthcare guidance was designed to limit the spread of COVID-19, the virus. It had immediate and sometimes drastic effects on the way that AT reuse programs operated. As y'all recall, we have some really relevant sanitization webinars that we have done, where some of that information and some of the slides we're going to be talking about, where some of that has been covered. But very important that the social distancing guidance from the CDC and the World Health Organization still relevant right now. So different ways of thinking about transmission and making sure that everyone is safe. And then that whole enhanced sanitization guidance. The impacts on the sanitization procedures are varied across the country, but I would say every reuse program that I've interacted with, which has been a bunch of y'all, sanitization was one of those things that changed. So while the basic sanitization procedures remain the same, and some of this, it says past tense, but we know it's still relevant right now, extra precautions and handling and separating, segregating donated devices, presented space issues for a lot of folks. We heard that. Also pickup and delivery issues. And so some of you have gotten creative in the way you've resolved those. We also had that broken supply chain. So that issue of a broken supply chain meant that the usual or preferred disinfectants, that's just one of many examples, weren't available. We saw the same issue when it came to batteries. We saw some tools that were affected. And now a lot of us, I know our reuse program and a lot of our partners around the country are struggling because of the chip shortage. So that's a supply chain breakdown that is absolutely affecting the reuse programs. So, being mindful of all of that. The impacts of social distancing and physical distancing on reuse operations are also significant. Definitely affected the number of volunteers, workers, staff, what have you, recipients permitted in the workspace. Some people had to really just close off their workspace altogether. In some areas, distancing on public transportation affected the ability of workers to get to the workspace. We heard that actually throughout the US, that there were issues. Also, this affected some procedures for assistive technology donation pickups and device deliveries. So, that physical distancing was a big issue and still continues to be a big issue. Also resulted in cancellation or modification of in-person fundraising events. And so we'll talk about some ways that people worked around those. The next section here, how did pandemic changes affect reuse programs when we're looking through that lens of the customer? And so once again, transportation, big issue here for sure. The workers, just like that, the reuse customers also a lot of times experience difficulty. There were a lot of folks that were getting very creative about the way that they could either get equipment to individuals or ways to get individuals to pick up the equipment. It's one of those things too, where just making sure that everybody was safe. So there were extended hours in some cases, unusual work hours in some other cases. Just like Marty was saying, this is one of the AT Act areas that we didn't really see a reduction in need. If anything, there was an increase in need. So individuals who are blind, it definitely reported experiencing increased difficulty in using public transportation. I know that was definitely true here in Georgia, and a lot of folks talked about that. A lot of it also had to do with the not being able to really navigate and be able to know whether or not it was safe. Is that public transportation sanitized? Understanding all of that. Although a lot of apps before, and Liz, remember those early days where we were talking with app developers about, and some big name companies that a lot of you are familiar with, about what's needed. The great news is now there are apps and features within phones that have been designed and were widely adopted already and being used to assist in determining proximity of people. So how close someone is and how far away they are. We also found that customers were affected by virus-driven changes to the device deliveries, and donors were also affected. So pickups were affected, having to ask that next layer of question of, does anybody have COVID? All of those questions. And so just thinking about how all of that changed in that space. The other physical distancing, social distancing impacts, the requirement limited access to the customers, as we said. We also came through and resulted in some suspension of some services for some folks, and some of the activities even. For example, some of the reuse programs had put into their workflow and into their procedures that they would do training, and there would be hands-on fitting and matching and all of those things. And that just was not a good idea anymore. And so had to figure out workarounds, and sure enough, you did, and we'll share some of those too. Also, folks with disabilities had difficulty continuing to shop for food, keep those essential appointments, socializing, just so hard. And that's also part of why we saw an increase in some of the reuse requests. We heard from a lot of you because of people really wanting to socialize. There was an increase, for example, in iPad request or computer request. And we'll talk more about that in just a minute. Mental health impacts, all ages. And I was in a meeting every day for the last 2 weeks around this topic, mental health. All different agencies that we're working with, and also all different ages, all ways that it's affecting people. So many aspects of the pandemic and strategies to manage the pandemic cause stress and anxiety. of people of all ages, whether it was the, working from home, learning from home, virtual classrooms, social isolation, inability to visit relatives in hospitals or nursing homes. And some of y'all have gotten very creative with solutions there when it comes to reuse. So thankful for that. And it's great that we have this community of practice where we can learn from each other. Anxieties about jobs, and, is my business going to stay open? Or is the, place that I work going to stay open? Grief, absolutely. I think we have collectively been grieving for quite a while over the loss of family members and friends and loved ones. And then greater than usual stress for healthcare workers and first responders. So a whole lot happening, as we're thinking about all of that. 40%, there's a survey, 40% of respondents believe the pandemic will have a long-term impact on mental health. That study, that question that you see here, and there are the responses. It's been repeated several times, and that number is right around the same every time with pretty much every survey that I've been seeing. Once again, across the lifespan, across age, and also looking at different demographics. So once again, thinking about how do we bridge isolation? A lot of our reuse programs did indeed help with that, which is great. So Liz?
You want me to cover the next section?
Sure.
Okay. So this next part, as Carolyn was talking about how it's affecting not only staff, but customers, I'd like to shed some light on what the strategies were that were used to mitigate the impact on some of the changes on customers. And this was really helpful getting the survey responses from some of you out there as well too. So we'll dive a little deeper into all of that. So it really came down to managing device donation and deliveries. Many programs reported initiating device deliveries if they weren't already doing it, or using some other alternative methods as well. So many folks, including us at TOLS for Life, we were mailing devices to the customer. There's still so much to think about there though with COVID and sanitization, but that really helped to get some of the devices into the hands of folks that need to try them out. Free shipping for tablets is another way that folks were kind of getting around this. Equipment delivery to customers' home, so actually going and delivering equipment to them directly. Contactless delivery for DME, so just setting up areas where folks could drop off DME and then take off, and then the team would take care of handling that equipment as well too. Creative strategies were developed to facilitate contactless device donation using prearranged procedures in designated drop zones. So it was really effective just hearing from some of you out there strategically kind of working on how to make it safe and keep it distance, but being able just to keep things moving as well. So next slide. Virtual meetings for interviews, doing demonstrations as well. Obviously, we all have been living in this virtual world more so than we were just in the disability accessibility arena in general. So with facilities closing or having limited access, all of these meeting platforms were very useful for folks to jump online, to do customer interviews, to do demonstrations of equipment as well. I know that that's something that we kept very busy with here in Georgia. And Missouri AT emphasized keeping staff well-versed in the use of virtual meetings with customers. So great job, Missouri, but we saw that across the board. We all just kind of rallied, jumped online and figured out what was accessible, what was gonna work best, in any way that we could to keep connections with people in the community. Videos for demonstrations and training. Videos were definitely used for device demonstrations when in-person contact wasn't possible. And so Maryland reported plans to make more videos to demonstrate devices. I think that would be helpful even after all this is over, just to have that available. That would make our lives easier and would make it really quick and easy for customers as well too. Oklahoma Able Tech created instructional videos to facilitate contactless delivery. So literally how to set up a hospital bed, which is so awesome. So keep thinking of that in mind if you haven't dived into the world of doing demonstrations and training on video, it's definitely a great way. We definitely encourage you to make it accessible, but it's a great way to, again, to stay connected, show demonstrations. And how awesome is that? Just showing the ins and outs of setting up a hospital bed and putting together equipment. So, Carolyn talked, just a moment ago about addressing social isolation, and that's such a big part of what we were all doing as well, along with just our daily activities of reuse and AT services as well. So just sharing just what's been happening out there in the world, in our community. North Dakota partnered with other agencies to launch a COVID equipment distribution program for rural nursing homes. So now part of a long-term loan program, the 1,250 devices, tablets and stands, personal listening systems, voice amplifiers, Bluetooth headsets, webcams, and smart speakers, serving 110 nursing homes, which is so awesome. Those are great pieces of AT to help folks stay connected. And so great job, North Dakota. In Connecticut, using CARES funding, the Connecticut Tech Act project partnered with area agencies on aging, Centers for Independent Living, AT Partners, and I don't know if I could, Quinnipiac University to create the Stay Connected program to provide appropriate technology for communication and involvement. And so this program also has a whole research component on social isolation, but so awesome to hear again, just Connecticut working with partnering programs and getting AT out there. And then of course, here in Georgia, TFL, we expanded our review of apps for safety and independence for a nationwide audience. We have our Tools for Life app finder. Shout out to Sierra Montez and our team for going in and adding even more when it comes to mental health, social distancing, and just some more apps that were coming towards the forefront as well too. And so of course we have a whole partnership with the Center for Disease Control and Prevention, CDC, lots of webinars, lots of helpful information that are archived and available for folks to use as well too. Virtual fundraising events. These were still hot and happening, and I'm just so proud of our community for just thinking progressively and just keep pushing through. Social distancing made traditional fundraising events really impossible because of it being in person. But so many transitioned to virtual modes, and it was really cool to see that happen and also make it accessible in a new way, which is so awesome for people like me that rely on it, pandemic or not. So supporters, they understood, and the commitment to even helping and raising funds was even greater. Planning a virtual version of an event is good contingency planning. So I think it all kind of forces us to think differently, and just to be thinking about how in other emergencies, how we can do this again, but also how we can just keep it going when we all are back in person for those people that can't participate in person. I often worry about, as someone living with a disability, is the virtual world going to go away? All these strides that we've made thinking of those silver linings during COVID, just let's not forget that. And let's keep all these virtual platforms going and the accessibility features moving so that way everyone can truly be involved. And so there's an image over on the right. I just wanted to highlight FODAC here in Georgia, Friends of Disabled Adults and Children. Their annual run, walk, and roll went virtual. Participants registered, sent photos of their activities from remote locations. And so that's just a screenshot, just thanking the walk and roll sponsors as well too. So FODAC did such a great job of translating that to a virtual environment, which was really cool to see. Staying operational remotely, Easter Seals, hang on one second. Easter Seals, Iowa is in the process of using all electronic signatures to minimize the need for physical contact, which is really great. And to expedite the application process, I'm all about electronic signatures being accessible and utilizing that. So I think that's such a great, just so simple, but something awesome that you can do to really help. All team members have the capability to work remotely with office phones rolling over to mobile phones. Again, good continuity of operations planning for emergency. So you'll hear us saying that throughout just our remaining time with you as well.
And, Liz, I think so appreciate everybody weighing in on the survey. And I think that we can't overstate those important points that you've been making pretty much from day one, when the world closed down, that actually the world opened up for so many folks. And, that virtual aspect and being able to finally participate, and this electronic signature, absolutely just good practice. And that leads into this next section, which are some changes worth incorporating into standard operations. And there are quite a few here that we'll go over, and we've got some, some ideas around that. So some of those retaining some good changes. Some of the programs will retain that no contact donation. Actually, that's a good idea. That's just a good idea for a lot of folks. Makes it a lot easier. And device delivery procedures, some will offer this now as an option. That has been long debated, or something that we've talked about within the reuse community of, do we deliver, do we not deliver? What are the pros, what are the cons? Do we have to physically be there for donations? Do we not have to be there? All of those things. Like Liz was saying, virtual consultations will be a permanent option for a lot of folks. And that's great. Once again, being able to do that match, that feature match, being able to, we've been able to provide a lot of services that way. I know a lot of you have too. And it makes a big difference. Doing the trainings that way too. We've also been able to provide some of those consultations, record it, and then the person can listen to it again, which is great, or be able to share that. Changes to sanitization procedures. A lot of folks, have agreed and said that they will be retained. That higher level, that indeed it did work, and that we were able to not pass on COVID when we're using excellent sanitization procedures. Having initiated the change for the pandemic, some programs will continue to accept donations of smartphones and tablets. This is one of those that you can see that I'm smiling, that I think a lot of folks felt like, oh, smartphones, tablets, that's so like yesterday. But those have indeed come back in a huge way. And what we're finding is that there are so many important uses for this, especially with some of the things we were talking about earlier. Supply chain has kind of fallen, into a broken state. And so with chip issues and chip shortages, some of those smartphones and tablets actually have been incredibly helpful. Also, with some of the movement to getting and expanding broadband. We talked about with a lot of you different strategies, and we'll talk a little bit more about that, of expanding broadband and that reach. And so having that tablet now makes more sense, and that smartphone, especially with so many more ways that we can use that, having that backup. Some programs plan to continue the pursuit of alternative sources of parts and supplies too. So that was another win, if you will. Having to go to plan, some people said it was not just plan B or C, it was actually plan, LMNOP, where they were trying to get, part supplies, and they developed some really good relationships throughout that process. Some other, lessons that were learned, the prolonged pandemic conditions differed significantly, as you know, from other emergencies. We talked about that, different than hurricanes, different than ice storms, different than tornadoes and what have you, where the stages shift from response to recovery more quickly. And you heard us talking about that. I think Marty, Liz, and I all are kind of like it. Actually, we're in different phases depending on where you are in the country, depending on where you are in your own community. Still, there are lessons useful for future emergencies, and that's the important thing here, is right. What can we take, in which the recovery process is more localized, but really can go on for an extended amount of time. So here's some comments to apply, some ideas to apply in this lesson specifically. So having alternative operating procedures in place for when use is needed, that is definitely a big lesson. And what we have seen is that some folks have had now new conversations, new partnerships develop so that they can continue operations. They have had partnerships, for example, with independent living centers or AAAs, or with DME supplier, and had different conversations, and even different ways of working with other reuse centers around the country. So keep that in mind. Create more options to continue operations from home. So what can we do from home, and how can we continue to serve customers and keep staff employed? Keeping staff up to date on the use of virtual platforms and staying up to date with those as that continues to evolve. Many new and stronger collaborations were formed. I would say that is for sure. And also help the program learn more about other organizations, local organizations' capacity, and also lack of capacity. I think that those are both very true. So I can't tell you how many people I know who had their assistive technology break during the pandemic. And so there was also an instant urgent need for not just one backup system, but multiple backup systems. And the reuse programs absolutely rose up time and time again to help. So, all right. Liz, anything you want to add?
I think you covered it. I'd be happy to cover this part here.
All right, I'll turn it to you.
Okay, so our last section is just consideration of unmet challenges. And so as we jump to the next slide, one thing that we all learned is that communication, a lot of it wasn't accessible really. And so that's been a big challenge for so much, especially we learned a lot working with the CDC, even just COVID communications and public health information. And so while we routinely deal with accessibility issues and assistive technology reuse, we realized that the two quickly became intertwined during the pandemic. And so a lot of communications were inaccessible, and in some cases, technology and AT reuse became a major part of a lot of those solutions as well. Access to the internet, obviously using computers, tablets, cell phones, it was so important that it was all working, like Carolyn said, especially AT as well too, because that was the main way people were communicating. So some programs had not engaged in reuse activities using these devices, right? And so that definitely changed a lot as well too. We also know that emergencies always highlight continuing challenges in powering devices. A lot of us have had many conversations about power and batteries over the years. Texas AT program reported exploring charging options for powering devices during extended power outages in addition to the pandemic. So great job, Texas, for just seeing the importance there as well too, because pandemic or not, that's always a big issue. More pickup services for large donations was a huge need. So obviously we all know that transportation was a big issue for some reuse programs. And so having to create those partnerships to help facilitate acceptance and pickup of donations of large equipment items. So we're talking maybe hospital beds, just bigger items as well too. We still at the Pass It On Center still get calls asking who will please pick up my hospital bed. I can't tell you how many times people are like, hey, I've got my hospital bed at the end of my driveway. I'm in California, can you come get it tomorrow? And so, or a power chair. So we can now tell them where to find their reuse program, but still often, just depending on pickup and large donation pickup, it still doesn't really solve that problem as well too. So just something that we need to collectively be thinking about. More assistance needed for completion of online forms in emergencies. So obviously, again, virtual world, right? Your computers need to work, your tablets, your cell phones, your AT to help you access that information needs to be working as well too. So the ongoing need for emergency response became an issue for COVID-19, even the vaccination initiative as well. And so there's still, we know this in the reuse world. I mean, this is our common dialogue, right? There's so many people, still a huge population, especially in our rural areas, that lack technology or even technical skills, or maybe even have just other issues that prevent them from completing forms online. And so really thinking about what all of that could look like, making forms accessible, but also just having alternate ways of getting all those forms filled out and just getting the information that we as AT programs need as we're serving our community. Key communications needed in alternative formats. Again, the pandemic showed us that there were so many communications out there specifically for folks with disabilities that just weren't accessible. And unfortunately, we learned that people with disabilities were a huge population, if not the largest population of folks that were disproportionately affected during COVID, whether it was acquiring COVID, battling the COVID long haul, dealing with AT issues, or ultimately death as well too. And so we know that it really exposed that weakness in communication to significant populations with disabilities. And primarily those were individuals who are blind or have low vision related disabilities, individuals who identify as being deaf or have hearing related disabilities. And then especially more so importantly, our intellectual cognitive disability community or low literacy skills. So we learned a lot this past year and a half about plain language and the importance of it. And so we encourage you all to either, dive into that deeper or to reach out. It helps, primarily people are thinking about individuals with cognitive disabilities, but it helps our aging population. It helps me when I'm feeling cognitively overloaded, right? And I just want simple, straightforward information so it can really benefit so many. We know this isn't reuse, but it affects the disability communities that we all serve. And so just wanted to put that in there for folks to be thinking about. We know that so many of you are already doing this, but it's so important that we make our communications accessible and available in alternate formats. So we've got some resources here for all of you, and we hope that this has been helpful as far as just the information that we were sharing, as well as just the information that we retained and got from all of you. We really appreciate just the willingness to share all of the information. And so obviously AT3, Technical Assistance Center, you can visit anytime to get information about programs, communities in practice, program news, and so much more. And so that website is AT3, the number 3, center.net. And then we also just wanted to highlight our project with the CDC, and it's our Georgia Tech Accessible Materials website. And so this is CDC COVID-19 guidance in alternative formats, Braille-ready files, American Sign Language videos, easy to read documents, as well as a ton of webinars that we've done. And so you can catch all that at cidi.gatech.edu/COVID. And
yeah, I did want to mention, Liz, that the survey link posted in the chat is not working. So we will send out a survey link to all of the participants. If not today, then first thing tomorrow.
Thank you for letting us know. What questions do folks have? I can't see the chat. I guess I can see the chat. Let's see. Let me see. I'm going to click on this. But do y'all have any questions for us? couple of things that we, have been also thinking about. For example, with the documents, we've been thinking quite a bit and talking with several of you about how much do we really need when it comes to getting people to sign off on documents. I think that much like Liz has said, simplification has been one of the themes also as we've collectively moved through this crisis together. And so, do we need to have all the forms and what's the best way to get, forms signed off? We have looked at various tools because we also want to be very mindful of security. Making sure that people, when they sign something, that it's in a secure way. DocuSign is the tool that we have found to be both accessible and also very secure. And so that's the one that we've been using the most within our program. And but also curious if there are other programs that are using other safe, secure, and accessible signature platforms. So that's one of the questions I would have for all of you. And if anybody has any questions, feel free to ask.
It looks like you have a question, Carolyn, from Allie Upchurch. Hi, Carolyn. What documents do you use DocuSign for?
Thank you. Okay, so the DocuSign, it's actually for any number of documents. Liability, usually if there's some liability language, and we need to make sure that somebody understands that, so going ahead and having them sign off on that. So to say, yep, and also the when just a documentation of that transfer of ownership. So, having people sign off, that, yep, they did indeed receive whatever equipment is that they received, and that it was working when they received it, and all of that. There used to be a lot more documents that people had folks signing off on, like this is the condition that you received it in, or you're assuming any of the liability issues or concerns. Some other things that folks would sign off on would be that you went through a matching, or that you didn't go through a matching process, or that you went through a training process, or you didn't go through a training process. And so those are some of the things that folks were signing off on. Does that answer your question, Allie? And hello? What does that say?
Thank you. We've been working on a way to get documents signed electronically, but we have to go through a USC's legal department, and they are very strict about what we use.
Okay, yes. So DocuSign is one that actually we've been able to use within our program, which is housed at Georgia Tech. We understand university systems. I'm with you, Allie. And that's been approved. Once again, accessible and also secure. So I hope that helps. Good. And what does that say, Liz?
It looks like, well, Allie says, yes, thank you and hello. Hope to see you all soon. And Clayton, hello, Clayton says, AdsTap in Arizona is using Adobe Sign. Very
good. Okay. And Adobe Sign's working well for y'all, Clayton? Good.
Yes.
Good. I did see that. I think that that's, one of the, details that's important to pay attention to. The other thing is the move that a lot of folks have made to producing videos. And so we've been thinking about, ways to perhaps share some of that. Liz and I have spent a lot of time making content evergreen and making sure that it would have a life beyond this time that we have right now, so that many folks could use it it would last a long time. And so, so that's another strategy that we have, is trying to cut down on that physical, face-to-face time, and allowing for some of the resources to be more, evergreen, but also around for a lot longer, which is good. More accessible too, which is great. Any other questions for us?
Oh,
go ahead.
I just wanted to mention that Jamie with ATAP reposted a new survey link, and it looks like it's working now. So that is in the chat for folks to access.
And do you mind reading that out?
Actually, I think that's still
Sorry.
that's not the right survey link, so we will send that out.
Okay. Gotcha. Okay, no problem. Any other questions for us? The other thing that I would just emphasize for everybody, and it's going back to that important piece that Liz was expressing. I do think we found a lot of new ways to work, where, as my dad would say, we're working smarter, not harder. We're not, wouldn't have to muscle our way through, ways to be even more efficient. And I do think that's one of the many things that I love about this community, is that we learn from each other. There are things that y'all shared, even in this webinar, that I know I definitely have learned from, and I'm thinking about ways to incorporate. And so, thinking about how can we be even more efficient and mindful of our resources of time and money. And then also, thinking about, some of the virtual fundraisers. I know that I've been able to participate in some fundraisers that I would have never been able to participate in because they were physical, walk, run rolls, or physical, like in-person auctions or what have you, dinners, what have you. And it's been nice to be able to, contribute and participate from wherever we are in the world. So thinking about all of those pieces and what we have learned, yes, there's been a lot that has happened during COVID, and a lot of lessons learned, and definitely some things that can help transform and I think make us even better. So Liz, anything you want to say as we wrap up? And I'll move to the next slide.
Sure. I just want to thank everyone for your time, and again to everyone that filled out our survey to help us pull together content for this. I'm really just excited to see some of the innovative ways that y'all are moving forward, and just love that y'all see the importance of it and how impactful it is for folks with disabilities across the board, especially in our local communities. Yeah, and just encourage folks to continue this virtual world as we're kind of getting back into real things as well too, and just know that it can supplement so much of what you're doing in person. I will say I'm proud of our team here at Tools for Life, because we've always had some virtual component no matter what. And so it made the translation this year and a half easier, even though we were still learning more and implementing more. And so I encourage you all just to keep it going and just let it kind of coincide with your in-person activities as well too. It'll really open up a whole world, not only for your programs, but just the folks that you're serving as well. So.
Yes, totally agree with everything you just said, Liz. So eloquent. And I, as I said in my opening comments, reuse is extremely important. And there's just so many folks that benefit from it. I was not surprised that it was one of the activities that had our phones ringing off the hook. And it's one of those that when everything was said and done, that people absolutely needed to make sure continued throughout the pandemic. And so, know that we really appreciate everything y'all are doing. We appreciate the community and the network, and everything that y'all have shared, so that we can all continue to grow and provide access and acquisition of assistive technology to folks throughout all the states and territories. So I'm going to turn that on over to Marty, and I hope all of you will stay safe and be well. And so Marty, all you.
Thank you so much, Carolyn and Liz. That's exactly what we were wanting to hear. I do want to say that the third time is a charm. The link that's now in the chat room is the right link for the post-webinar survey. So please try again, and please complete that. We will be sending it out to everybody in addition. So again, thanks. Everybody stay safe and have a great afternoon.